Good evening, everyone. This is Sambhavi, and I'm honored to welcome you all to today's introductory webinar of the NCD Compass course. This webinar is brought to you by Nepal Health Corps, and the course itself is from ActioNCD, which is being facilitated by Nepal Health Corps. I'll be your moderator for today, and I'd like to thank all of you for joining us. It's truly encouraging to see such a participation in this action-oriented journey, which is focused on non-communicable disease. So before we begin today's agenda, I'd like to briefly introduce ActioNCD to you. ActioNCD is a global initiative which is dedicated to reducing the premature deaths, which is caused by non-communicable disease. It has the core mission to empower health workers and communities, and they have a goal of reaching the target of UN, the 2030 target of reducing non-communicable disease-related mortality by 1/3. So basically, ActioNCDs works on three major initiatives. The first one is NCD Compass Course, which we are launching today. It is especially designed to build skills among the frontline health professionals. The next one is NCD Solutions, which is focused on co-creating the country-specific and evidence-based intervention packages. So the next one is NCD Nexus, which is all about connecting the global experts to local leaders for sustainable and context-driven impact. So at its heart, ActioNCD is all about deep collaboration, and the collaboration is between the local health systems, the policymakers, the communities, in order to ensure the sustainable and system-oriented approaches to prevent NCD and control it. So regarding this course, as I've already mentioned, it is designed to equip the professionals or the civilians, the academicians, the people who are working in the government, all those who are interested in serving for the community. And it is designed to skill up them, to provide them tools and networks so that they can advance NCD action through a system thinking lens. So rather than just a training, it's a community of practice where if we get enrolled, then we will be engaging in the connection with global experts, collaborating with peers, and we also will explore how to apply the things that we learn to the course to our community, to the real world. So today we have planned our webinar to be providing information on NCD Compass course, a detailed orientation on that. And then we will walk through the course structures and then the themes and expectations. And also at the end, we will have a question and answer session so that we can address your queries and reflections that you will have in between or at the end of the session. So we're excited to learn from the experts that we have here today. And I would like to encourage you to stay engaged, ask questions, and stay on mute during the presentation to avoid the background noise. If you have any questions or queries, I request you to share it in the chat box throughout the session. Also, I would like to notify you that the session is being recorded and will be shared in our socials soon. So we are privileged to be joined today by two esteemed NCD experts who will guide us through this course vision and its application at the ground level. So our first speaker is Dr. Temo. Dr. Temo is the founder and director of ActioNCD International. He also served as the unit head of WHO NCD department in Geneva and NCD coordinator in Western Pacific region. So, department in Geneva, worked as NCD coordinator in Western Pacific region. One of the facts that I would like to share here is he is the one who pioneered Walk the Talk initiative, the initiative that we were also a part of and conducted one session with WHO Nepal last week. So he has also initiated a lot of global policy efforts in physical activity and nutrition. So he's the one who founded ActioNCD International in order to empower a new generation of leaders to accelerate the progress towards reducing the NCD mortality. So today he will walk us through NCD Compass Course, its vision, its structure, and how we can be a part of this course and lead it to strengthen the system, our health system actually, to tackle the NCDs effectively. Dr. Temo, the floor is yours.
Thank you very much, Rikari, for that very nice introduction. Dr. Prajwal and all the colleagues from Nepal Health Corps. It's an absolute delight for me to be here and to present to this team of champions that are already there in Nepal. And so, with that introduction, I just want to say how delighted I am to do this. So, thank you for championing the cause in NCD in Nepal, and even hosting this webinar. I must say, this is the first webinar that's hosted by a group like yours for us to actually present. We have been hosting webinars and doing it ourselves, but your initiative even to get this webinar hosted and taken forward is a great signal to the commitment that you have. So let me dive straight into it. I want to address this with this title of a Nepal NCD ready workforce, because that's exactly what this is about. We want to get the workforce in Nepal to be NCD ready. So a few introductory remarks before we dive into the NCD Compass itself. In non-communicable diseases, we are talking about the four main risk factors and the four main diseases. I know you'll hear about talks of the 5x5 by WHO that includes mental health and also air pollution. But for the purpose of this and the course, the focus is on causing the four big diseases that we consider non-communicable diseases. Now, the challenge of NCDs is that it causes about 17 million premature deaths every year. Every minute, 32 lives are lost before the age of 70 years due to non-communicable diseases. And that's what premature mortality is defined as. And the more crucial factor is the fact that 28 of them occur in low and middle income countries. Why? Because there are lower levels of protection from risks and the consequences of NCD than in higher income countries. And if you see this graph, it's also a question, an issue of disparity. If you are born in a country like mine, which is Fiji, and that's towards the higher end, your risk of dying or getting one of these diseases and dying from it is much higher than if you were born somewhere else, in Japan, for example, where the risks is quite low. So it's not just that it's huge, it's happening in those that are most vulnerable in the developing countries, and the disparity between countries is quite huge. And that's why we have to tackle it. And the way the world has decided to tackle this is to make a promise that by 2030, 33.3% of reduction in premature mortality due to non-communicable diseases. Great promise, but how have we done? Up to now, only 19 countries are on track to meet the SDG 3.4 on NCDs. Now, we had some very good decline initially from the period when we started this in 2000 up to 2010. There was quite some rapid decline, mainly due to reduction in cardiovascular diseases. And I know Professor Dr. Prajwal is of interest in this space, and chronic respiratory disease and tobacco use. But ever since 2010, the momentum of change has really dwindled, and the annual reductions is much lower than we would really like it to be. So we have not done well. If we zero in on Nepal, how is Nepal actually doing in terms of NCD premature mortality. Now, in 2018, which uses 2016 data, you will see here that Nepal had approximately 22% of premature mortality at the start of the biennium. In 2015, the baseline that we use. Now, the red line is where, if all things constant, is where Nepal should be having a reduction in premature mortality if they are to reach 15 or 14 point something percent by 2030. But instead, in 2022, you have remained relatively constant. And so the fundamental question for Nepal, including National Health Corps, is what has happened despite all the work we are doing. This is the picture it is showing. The COVID is partly to be responsible for the increase in death. It doesn't do the reduction, but Nepal is on the flat trajectory as far as NCD premature mortalities. Now, if we dig lower than that in the Nepal situation, and you look at from 2018, where you have this page on the left, and then in 2022, when you have this page on the right, this is the global monitoring report by WHO. Okay, we haven't achieved the target yet, and we are not in the decrease. If we take a look at the different policies under reach of that outcome target, you will see that Nepal has done quite well in a few of the key policy interventions, but there is also still quite a few gaps in there. One, for example, an unhealthy diet, right? You will see that you don't have salt or sodium policies yet in place in Nepal. And I was challenging the few that we've had a discussion with, that as you run your tobacco campaign, that the other risk factor that's directly linked with hypertension, cardiovascular disease, and death from it is the salt, excess consumption of salt. And I've tasted your nice Nepalese food, and part of the reason why they are so nice is because of the level of salt in it. Right? As an example of some of the reasons why your trajectory may be not heading in the right direction at the moment. So there's a bit of work that needs to be done at this level, at the policy level, in order to achieve that target we've promised ourselves and we've promised the world. And this is where ActioNCD International comes in. Thank you very much, Adhikari, for that nice introduction to it, which might take you up. You've explained it so well there. But we are here to help deliver on the 33 by 30 NCD promise. Who are we in ActioNCD International? We have what I call the 360-degree expert in NCD and public health. These are world-renowned public health experts working on NCD in more than 15, 20 years. And collectively, we have about 100 years of experience in the NCD space up to now. One is or even one of your esteemed colleagues from your region, Dr. Cherian Varghese, who is from India, that's actually there. Now, we have developed, and you may have seen those who've gone specific in different areas, the diabetologists, okay, the cardiovascular. But there's only a few in the world that has the depth and the breadth of the whole NCD agenda. And that's the group of experts we bring to the table, we bring to the country to add value to the work that you are doing already. And Adhikari has explained what our 5 key main services are about. Now, if we then move on, what framework are we looking at? Now, up to now, there have been plans, and you go to the different ministries of health, you see nice NCD plans sitting there. Some of them are collecting dust, some of them are being implemented partly, some are not costed, some are used as a political agenda, some are used as a fundraising tool. Different forms, different ways. But we've come through the planning phase, and now each country has some sort of a solid or a sound NCD strategic plan. Now, what is needed at the moment is acceleration. We have 5 years to go till 2030, right? And we have developed a acceleration framework, and we call them acceleration levers, to help countries to progress on non-communicable diseases. We've simplified it to the 5 Ps. The people, which is you and me, we need to make us a NCD ready. But we need to have power, and power comes in terms of political knowledge and also resources. And together with partners who are mainly communities, experts, and implementing and funding organizations, we develop our country NCD best buys program based on evidence, based on best design and best practices. And we implement that through the process or through the systems that is mainly consisting of community setting, health system strengthening, and multi-sectoral coordination. If you liken it to a train in Nepal, no, I'm not sure. You have train in Nepal, I'm trying to think. Maybe it's the other mode of transport. That you really have people who need the power and the partners to actually run the program. Sometimes we develop program and we try and find people to run them. You're kind of the other view. You find the people, you develop, you nurture, you build the capacity, and you build the program around the people in order to be successful in this. So the shift that is needed is that to achieve the SDG 3.4, we must secure the political power. We must energize the people and systems, attract partners, package the programs effectively, and build sustainable processes in order to achieve this. This is what we believe that is actually needed. We need acceleration. We need to shift gear from that of business as usual to that of this is urgent. And behind those numbers in SDG, actual lives of people that need to be saved or people that needs to be prevented from getting these largely preventable diseases. Now, so we need political power, people on fire, partners with cash and systems at scale. How does that sound? Sounds pretty nice, nice rhyme, right? Kind of almost a jingle now for health corps. We need political power, people on fire, partners with cash and systems that can scale. Gone are the days of little intervention in the corner somewhere, different parts of Nepal. This is a time for us to come together and really drive the action collectively, because there is power in that coming together. And having 5,000 youth who are focused on this in some form or in some part of it is exemplary of that force that we actually need. So with all of that, we're going to zero in then on this NCD ready workforce. Out of all the P's that I've described there, the one that we are most focused on and we think is the priority is the people. Because it is the local team that's going to make this change. Those from the outside can come in and provide some support, but it's the local team that will actually do the job. And so WHO had actually defined NCD ready workforces, those being highly skilled, well-trained, and well-resourced health workforce to lead and implement actions to promote health and prevent and control NCDs. Without them, we basically cannot achieve the UHC. And WHO had set a pathway to building an NCD ready workforce. And in alignment with that, we have provided what we are bringing to the table around the world. And the NCD ready workforce is 3 components to it. You have the capacity empowerment, which is about building capacity, knowledge, capability, skill. But then we also have NCD and public health coaching. Encourage you to get into that, even those that are graduating and not particularly certain of which direction you need to take. We have available NCD and public health coaching. And then we develop a worker community that is able to actually take this forward. So you don't just join a course, you actually join a worker community. And we have some targets to reach come in 2025 even for health workers in 50 countries. Can be done, should be done, because without this, we won't be able to achieve the target that we have. So what is the capacity empowerment track that we have? NCD Compass then is the first. Now, NCD Compass, a bit of history on why it was developed. We had developed this because we thought the health workers, every health worker needs to be a champion of NCD. You cannot afford not to be learning, not to be knowing about NCD. So this was actually meant for all health workers. It's the fundamentals of NCD. It's the A to Z, as you say, in non-communicable diseases. So it's meant for all health workers. Basically about NCD prevention and control. And there's a component of leadership in there, which I will explain further. But just to go through that, you are not just having a one-off training. We put you on a track to be able to become that NCD ready workforce or that NCD champion. The NCD mastery is what we then move people who spend more than 50% of their time working on non-communicable disease, what you would call an NCD core team in the country. Yeah, then have an NCD mastery program, where it's a more extensive, more depth, a deeper dive into all of the areas, and it's a longer course. And the main focus of the NCD mastery program is the implementation of your national strategy, nothing else. Take the strategy, we build a course around that together with your local institutions, and we drive the core team in actually learning that. And then the third package is really about thematic NCD program. So you focus on particular areas, right? And I will show you a few of that. Now, all of that is underpinned by a global health guardian program, which is coaching and mentoring, right? I know these two words are used interchangeably. Mentoring is basically, if you want to go somewhere, ask those who have been there. They mentor you, they guide you on what to do and what route to take. Coaching is about asking the right questions using psychological-based counseling methods to improve the capability of those that you're actually working. Now, all of that will become part of the community network, which is really about mastering public health and non-communicable disease together. So we don't just get you on a course, we put you on a learning journey that we excitingly start together. Now, I can now zero in on the NCD Campus course as part of the Capacity Empowerment Program. As I said, the NCD Campus main objective is to equip every health worker with critical knowledge and tools to combat NCD, contribute to care and transform their practice. Okay, this is the characteristics of the course that we run. There's always going to be an action that you need to do. It is not passive learning. This is very active learning, and there's an action part that comes with it. The other thing that we realize is that all health workers, approximately 80% of health workers, are exposed to one of the risk factors, or you suffer from one of them yourself, or NCDs. Even if you're lucky to escape both of those, you at least have one close relative or friend who does. And so every health worker has an opportunity to either influence his or her own or influence his or her relative and colleagues. That's why we say every health worker needs to be a champion of NCD. Anything short of that impedes our collective mission to deliver on the NCD promise. Now, you might be asking the question, why do I need another campus in life? The NCD campus, why do I need a campus? Right, the three key objectives are enhance your understanding of NCD, right? You think you know, but I think when you dive into the course that you will realize that there are things you don't know. Now, the issue with non-communicable diseases is that we have fragmented the agenda quite a bit. We now have tobacco specialists, health promotion, nutrition. This is the one course that brings all of that together, right? So we go in a united way, in a coordinated way. Now, we also is focused on developing leadership and advocacy skills. We don't just get you to have head knowledge about the technical aspects of non-communicable disease. We develop your leadership and advocacy skills. All right? And together with it, we promote innovative and sustainable health solutions because you're going to actually get to develop and work through a solution of yourself through the course. The curriculum is actually 6 times 1.5 hours online. Face-to-face option is also available, but the online course is what most countries are taking up now. And so in total of lecture time is about 10 hours in there. And included with that is exercises and homework. Why do I need a compass? The few reasons why people take the course. It directs you to the most burdensome health issue. This is one of my ulterior motives. For those who are not sure what they want to do in public health specifically, take the NCD Compass course. I can be almost certain you're going to take up NCD after that to focus in your public health career. Second, it helps, okay? Self, colleagues, and friends and family. It's amazing how you put a group of health workers together and you ask them, what's your numbers? Meaning, what is your blood pressure level? What is your sugar level, your cholesterol level? And you just ask those simple questions. It's amazing how health workers don't even know the status of themselves. Huh? I might want to do that quiz in this webinar as well, but I'm sure that there's some of us who don't even know what our status are. So it helps ourselves, our colleagues and friends. It influences the behavior, lifestyle, and practice. For those of you who may be still smoking, I can challenge you that by taking the course, the knowledge that you get and the empowerment will make you leave that cigarette butt in no time as you gain this knowledge. Huh? Integrate. So a few of the countries, the reason why they're getting the health workers to take the course is because they want to integrate NCD and other programs. And so this is a great course to have. So in Malawi, for example, the HIV/AIDS team are actually the ones taking and running the course because they need to learn about non-communicable disease before ever any integration could actually happen. Yeah. And then also for public health career professionals, some who have taken the course have now committed themselves to actually take NCD as a discipline in their public health career. So it helped leads people who have graduated into having a career around public health and non-communicable. So that's why you need the compass. The modus operandi of this is you dive into it. We like to make it fun. Life is already bleak. Right? So we want to keep this fun. The learning needs to be fun. At the same time, it needs to be serious because it's lives of people that we are dealing with that we need to be equipped to actually serve. We want to keep it active. So always you kind of have that movements happening during the course. Technical content is rich. The quizzes that come after every module is what gets you straight into application. We've included a few technology hacks in there. Nepal being so up there in terms of technology, probably something you can contribute further to. And then you have an action project or a live project that you actually develop as a result of the course. That is one of the most exciting ones because we even see a progression of the project as the course goes on. Some starts with themselves, and by the end of it, they're actually taking the whole province of millions of people to address. And you joined a community of learners, but also a community of those who are taking action. The facilitators, I've told you, just to say that, more than 100 years of experience across the whole lot of us. And you get to interact with them, or some of them, through the course. The outline is here. You set the stage for change. Then you move through grasping the global burden of NCDs, both in terms of health, social, and economic impact. You look at risk factors. You navigate the disease management and strengthening of health system, as Edgar was mentioning. We look at crafting meaningful NCD programs from vision to reality. There is a focus on raising voices, shaping policy and advocacy for NCDs. And I think this is something Health Corps is really moving towards. It's your voice to the world on NCD that you want to amplify. And the course touches on how to actually do this, because communication is terribly undervalued in public health. In health, we seem to think that if we develop programs, people will automatically respond to it. They don't. And that's the reality. And you need to include communication and mobilization strategies for people to be able to respond to that. That's what module 5 is about. And then module 6 is where we touch on leading with resilience. Here we are no longer talking about technical stuff and knowledge on NCD. Now we focus on you as a public health professional. Why are you here? Why are you doing non-communicable diseases? If it's just part of a job, then fine. No? Probably not going to last. It is part of your dream, part of your purpose in life. Soupe, as we say in French. That's where things begin to be just not a job, but an actual calling, an actual vocation that you have that will drive you no matter what comes. Then module 7 is when this exciting time of developing and presenting your project, which we then take further. All right, let me dive into this. So when you enroll in the course and you go in, you enter into the medium of virtual learning, which is great. It's only way we can really bring this to scale. So you, I hope you can see my screen. Yeah. Again, there's an English and a French version at the moment. And then you get into your English course and you go right in and you start step by step from those modules that I was talking to you about. And you have a video that you actually play and you work through. Each of the module consists of 1.5 hours, and for each 1.5 hours, you have 30 minutes chunks. So it's broken down to you in 30-minute slots where you then listen well to the course, to that section, and then you move on through the different areas. What it usually consists of is you got, for example, in the global health burden, in the first module, grasping the global burden of NCDs, we then broken it up into 3 sections: the global health burden, epidemiology and demography, the economic impacts of NCD. And at the end of it, you have a quiz that you apply your knowledge right away to. And then you have homework. I know students love homework. How can you do learning without homework? The homework is actually then starting to build your project, right? Module by module, you are doing the exercise to apply that learning. And then you have some homework to research out to build up the project that you ultimately have. So that's how it is actually structured in there as you go in. And so it's quite flexible, so you can take it when you have the time, knowing that how busy some of you are. Now, if I can. Now, you don't only join that, you also join a community, as I said, right? So together on the platform, you then join this community of learners where you then interact for those who are actually taking the course. So you can see here, there's different groups taking different courses, and so on the NCD Compass, when you join, you come in and you interact with people from around the world that are actually doing. We've just welcomed Team Malawi. We have exchanges that are done here. You will have announcements that are done. You have Q&A questions that you put in and we can answer right away. And we can develop channels. Let's say when Nepal gets on as a team, we probably will actually have a channel directly for members from Nepal. And so you interact one with another, but you also interact with the rest of the world that's actually taking the course. In addition, we then have the global community that's out there in social media called NCD Countdown 2030, where everybody joins in and they have their interactions. And we will actually be later on leaving a lot of the resource material on this private Facebook page as well. And so when you do get the slides, you can actually log in there even before you start taking the course. So that's in a brief how the online course then looks like as you go through the 6 modules. And then at the end of the 6th module, you are given a link. And that link, you book a call with one of the facilitators or faculty members. And by then, your project has been developed as you come along. And now you have an interaction with one of the faculty members. You discuss the project, the scope of it, the design, and so on. And then you actually make a live presentation to your faculty members in 5 to 10 slides about the project that you will take on. And that has been a journey for a lot that has shifted from one project for them individually in their setting to one that is now considering the whole province of 6 million people to actually address. And it's amazing how you start small and by the end of the course, you are really thinking and wanting to act big as far as NCD is concerned. And once you've got that project presentation done, then ta-da, it is graduation time when you will get your NCD champion certificate that will be accredited by ActioNCD International, the University of Lausanne, where we have partnered with here in Switzerland. And it is also where a local institution could actually co-badge this if they do accept that curriculum. And then you have a NCD champion certificate that you actually do get. So that's the journey you take in regards to the NCD Campus Course. What have people talked about in regards to this? Some quite significant testimonials. This guy, Mr. Raymond from Ghana, he's actually said, I feel the module 6 in particular has been a turning point for him. He's now so inspired, challenged to break free from the limiting mindset, and now he believes he can do anything. You can see that's not really NCD technical and head knowledge stuff. This is empowerment stuff, right? That is now made him, and he's one of the key drivers now, the NCD program in Ghana. Linda from Kenya, who've actually used this as part of her career development. We've got Sato from Lesotho there in Africa, who is a nutritionist, right? And you tend to work within your narrow space. And what the NCD Compass has done is open her vision of the whole way to address NCD. And now he's integrating NCD program into her nutrition program and running it in her own province. So the experiences and the testimonials from the countries are varied, but not just in terms of in-depth knowledge on NCD that they could apply, but also these other benefits of being empowered through the course and even broader and strengthening integration at the local level. Now, that we have a special group, right, that we're going to speak about. That's why I put this slide, but we'll come back to that. But just quickly before I then close, it doesn't stop there. As I said, the journey then continues. After you have the NCD campus, you have a choice. If you're part of the core NCD team, you join the NCD mastery program to take you further. Yeah. And in that, it is focused particularly on your NCD strategic plan implementation in country. I will not go through this in detail, but this is done together with the country, focus on the country implementation of the core team that's there. So it consists of quite a longer 30 hours online, 5 days masterclass face-to-face, and mentoring and coaching comes together with it. And it's an ongoing program with the country team. That's the NCD mastery. And then if you want to really learn specific areas, one of the ones we are considering with the NCD health corps, with the health corps in Nepal is communicating the non-communicable disease. How do you develop nice, good campaign to run and measure well for effectiveness? We don't do well in doing campaigns. And so this course is particularly for that, which focus on a particular area of non-communicable disease that you want to go in-depth knowledge on. These are examples or pictures of where these do that. So that's the mentoring and coaching program. The summary of the evidence based on that is absolutely clear that we should take up. And you join a worker community and network. So basically to say that the journey continues. And back to this with the start of the NCD Compass is what we are focused on. And question then, how much does this all cost? They usually say if you want to invest in something, invest in yourself. And the NCD Compass course is pitched at $297 for all of that in the 6th module plus the 7th one to take in terms of presenting that project that you take forward. But for special groups like the Nepal Health Corps, we now have an arrangement with the team that for the first 50 workers, and maybe Prajwal could talk to him, for the first 50 or for a cluster of 50 workers, guess what? We are only levying $1,500 for it, which brings the cost down to $30 per participant to be able to take this course. All right? And so that's a special offer for countries that we have because we don't want to get the team started, get onto it in progress, and they'll be able to then cascade and teach others as well. Now, if you need to inquire further, we have a QR code there as well. But maybe at this time, I will open it up for question and answers and just leave this here with the price that we actually have for this course. And maybe Prajwal can also speak to it in terms of the group. So I think I'll stop here and see if there's any questions that anyone wants to ask and progress the discussion further for the health corps. Thank you, Adhikar. I'll hand it back to you and to take it on from here.
Thank you, sir. We will be taking all the questions at the end of the session. So I request everyone to kindly write their questions or any inquiries if you have in the chat box. Sorry. Dr. Temo, we are very grateful for your time and thank you for handling us the compass that we really did not have. And thank you for directing us to lead excellent NCD action in our country. And I would like to add one personal comment here. I'd like to thank you for commenting about Nepali food and thank you for loving it. I'm not sure if you had a chance to try Nepali momo, but that's an experience in itself. And I insist you to have it while you are here next time. and about the shift that we need in order to reduce the NCD mortality by 30% by 2030. The things that you mentioned, the political power, people and fire, the partners with CAS, and the systems that scale. I believe you have ignited the you have ignited the people and fire inside them here, because we have the health professionals, the medical officers, and moreover, the future health workforce of Nepal. Everyone is here from all 7 provinces of our country. So I think you have ignited that well enough. And for partners with CAS, I think maybe this collaboration with ActioNCD International is the perfect spark for Nepal Health Corps. Maybe we can start with $50 per child, as you once taught me to ask for. And thank you. Thank you very much. Thank you for sharing such an insightful and energizing talk. And I would like to thank our ambassadors and green members who are here today, that they have been doing excellent job in reducing the premature mortality. Maybe we're not doing that at a scale to reduce it by 30% in Nepal, but with ground level advocacy and local partnership, our ambassadors and green members, they are the passionate network that have been working for this. So thank you, everyone. Moving on to the second part of our webinar, we will now explore how NCD Compass Course will be applied at the ground level, particularly in the developing countries like ours, basically through primary healthcare and community engagement. To speak on this, we have our very own Dr. Prozol Packerel, co-chair of the NCD Prevention and Health Promotion Working Group at World Federation of Public Health Association. He is one of the researcher who is building the capacity efforts across all Nepal and beyond. His work emphasizes the community-based strategies, policy development, and international collaboration to reduce the NCD burden. Dr. Packerel, the floor is yours.
Thank you, Somabi. Thank you very much. Dr. Temo, thank you very much for wonderful the way you highlighted about the course, NCD Compass course. I think it's really inspiring for all of us. I did this course, about NCDs a long time back. So, but every time when I come across such courses, I get inspired and motivated to do more for NCD prevention for the globally as well as in the population of Nepal. So thank you very much, and I think this course will be very much helpful to all the young colleagues as an NCD and an NCD in late 2011 in 2011. So at that time I was offered one course at International Society of Cardiovascular Epidemiology Prevention in Fiji. So I went, and they told me that you will be provided the travel grant and the lodging and fooding, but you have to bear your own airfare expenses. But I invested that, and remembering that, I think that it was worth expanding for that course. So from there my career began, and I worked in a lot of places for NCD prevention after that course. So I believe I have a suggestion to all the young colleagues is to invest this is not a huge amount, which Dr. Temo has given us the package, 50 participants, $30 per participant. That is not a big deal. So let's enroll in this course, learn about NCDs, how we are going to, because it's not easy, this is not simple as we think, and let's learn through this course, and let's try to apply at the grassroots level, at the community level, and my point is now at this stage is we have to hit at the community level. By patient-centric interventions, community level interventions has to be developed in coming days. We can discuss more, I believe. I think we have a good team over here. I think they all are doing good work for anti-tobacco campaign in Nepal as well. A lot of effort has gone for that initiative as well. So I believe we are building a good team over here, and hopefully we can contribute for the NCD prevention Nepal in coming 10 years or so. Thank you very much, Samabi. Over to you. Thank you.
Thank you, Dr. Prozol. Now we will open the floor for questions and inquiries and discussions, of course. Please feel free to share your questions in the chat box. We will do our best to direct them to our speakers that we have here today. I'd like to hand over this question answer session to Dr. Deepika and Nirupa from Nepal Health Corps. Over to you guys.
Hello and warm welcome to everyone. And thank you, Dr. Temo and Dr. Prajwal, for the wonderful presentation. And thank you, Sambhavi, for handing over the session to me and Nirupa. I'm Dr. Deepika Navisani, and I will be looking at the question answer round. And with me, there is Nirupa. So if you have any questions, you can put them in the chat box. It could be related to the program, as well as Nepal Health Corps, or it could be related to ActioNCD, or how you can use this course for implementing community-based projects. So if you can write a question here, we will be sharing them to Dr. Temo, Dr. Prajwal, as well as Dr. Ayush, and we'll get back to you. So I encourage everyone to clear out any confusions that you may have regarding the course as well.
I guess there's one question. Duration of the course. So I would like to ask the question to Dr. Temo. So what is the course duration?
Right. Thank you for that question. As we have explained, each module it's about 1.5 hours, and then you have the exercise and the homework and the project. So when you look at it in total, it's about 10 hours of work, listening to the lectures and doing the exercises. You might take longer, you might take less, but approximately 10 hours of time that you invest in this. Now, there are some who actually dove into the course and said, oh, I can do this in 2 days. But then when they start getting onto it, they realize that they need to keep coming back to certain concepts, to certain issues. And so, 10 hours approximately time you need to invest in this. Now, how long does that last? It's totally flexible. It's up to you or up to the group. But what we have encouraged that we are doing it together as a group, because you need to have a time limit to this thing. Otherwise, it never ends and you never get to actually do them. So we encourage team that within a month, you should be able to complete these 10 hours and you actually have a presentation done and graduate from there. Because you can then have that flexibility in between on how you break up those 10 hours, but within a month is a good time to actually aim for it. Some of you can finish it in a week, I'm sure. But in terms of length of time, a month as a group would be great to have.
Thank you. Thank you, Dr. Temo. We have some common questions that were raised through our webinar. So first one that I have is, what are the scholarship eligibility criteria and the application process for the course? Could Dr. Temo answer that?
Yeah, so I'm assuming in regards to this, scholarship is part of the package that we've actually offered there of the price tag that we've got for 50 health corps to actually take it at $30 per individual. Now, just to say that the key there is to actually have the 50 individuals that will take it up, and that's when the $30 is actually levied per person, the total cost of 1,500. Now, any further scholarship from that is something that's probably to be discussed with Dr. Prajwal in what we can offer in regard to any more than that first batch of 50 that we will have. In terms of criteria, the only criteria in here is that you have some professional training in health, whatever that may be. As we said, that it's totally focused on health workers to develop them to be NCD champions. So anyone with health professional background is eligible to take the course. In terms of scholarship further, and the package we're offering is something we will probably discuss with Dr. Prajwal in taking it further beyond that 50.
Yeah. So, will the course offer field-based or hand-on components? The question is for Dr. Temo. Will this course offer field-based or hands-on components?
The course is actually both. Huh? We have field. If I understand the question well, it actually provides experiences from the field, and you will find that it very suiting to low and middle income country, developing country context is most of what we bring in the course, but also the hands-on experience is really from the exercises, the homework, and the project. Yeah. So you have both that component of on field-based experiences and knowledge that you gain, but also very, very hands-on as you go through the course.
Thank you, Dr. Temo. So there is another question. So there are so many questions for Dr. Temo here. Another one is regarding any opportunities that may be for alumni networking, mentorship, or involvement in NCD-related projects after completing this course.
Absolutely. Now, I did not present the whole this whole slides there. We also have special packages where you get for the course of the NCD Compass, you get a couple of things. Maybe I can show it if time allows. You get a ebook that we've actually developed called The Next, because one of the key questions in the youth and young people professional is what's next. So we try and answer that with an ebook. We have the Chat NCD board, which is a board that you access and you interact with the board NCD documents, and you've got a machine to learn them, and now they respond to you. And then there is the coaching, which is actually priced at 500 per participant, but you get it all together for the cost of the NCD Compass course that you can actually avail yourself through it. Now, as a package for the country, I'm kind of preempting it now, that those from the 50 which you actually get on the course, we'll probably be talking with Dr. Prajwal on who out of that 50 could actually then be taken further to enjoy some of the coaching and mentoring component that we have. And so that's a discussion for the future. But yes, the track from the NCD Campus Course. So what happens with the countries whenever we face, for example, like the colleague from South Sudan, whenever we interact with them, we put them on the NCD Campus Course, and straight after that, or during as part of that, we introduce the coaching and mentoring component. And there we are talking not just NCD, we're talking about professional life, we're talking, some even get into personal, individual life situations. So we have to have a separate individual time with them. But all that to say is that, yes, there is opportunity to then join the global mentoring and coaching program on NCD and public health as part of the continuing journey from the NCD Compass Course.
Thank you, Dr. Temo. I think that is a very promising reason to join this course as well. So we have a last question today. It's for Dr. Prajwal. Once our participants will be having this course, what kind of community-based initiatives can they work on, and how will this course be helping them? Dr. Prajwal, could you take the question?
Yeah, what I think these days is, as said by Dr. Temo, think globally and act locally, to start this project in India, Nepal, Pakistan, and Mauritius. So Mauritius will be the origin of this idea. So this ISOL concept idea. So basically, by 2035, we have a target of a reduction of diabetes by 5%. So they have a target of that. So on that vision, we are working in different country context. So that's our idea. So and we have a 5 interventions over there. So the first intervention is about developing a clinical algorithms. And second is training the layman about the mental health support. So there is a program called Ben's Grandma program, which we are thinking of initiating that. And another is about frequently innovative digital health solutions. So we are thinking from that perspective as well. And there is another concept, so the concept of social entrepreneurship. Okay, so how we are going to empower the people in the community for for these activities as well. So we will do a lot of capacity building trainings to the people of community as well. So these are the basic ideas. And I think we conduct meeting every month, and the colleagues from 4 countries come together and discuss about how we are going to do these projects. And I think it is going in the right direction, I believe. And we are also trying to talk with Dr. Temo regarding this, and try to collaborate with X and NCDs, and with the global partners as well. Thank you.
Thank you, sir. Regarding the question that our participants had, like what kind of a community initiative that Health Corps ambassadors or the green members can do in their community or at their school premises, college premises, what kind of activities can be initiated from our end, from utilizing the local resources with minimum resources, of course. What activities can we do so that we can add up to the projects that people like you have been doing, our government have been doing to reduce the burden of non-communicable diseases?
Yeah, what I believe these days is, every individual can make a difference. So everybody has some capacity and they can make a difference. And for the prevention of NCDs, you need high deal of commitment, passion, dedications. We have to work, at the ground level. So Dr. Temo recently, just now, shared about the NCD Compass course. I think such type of courses will help you, and to develop your thinking and broaden your horizon. So that we should do such courses, and take those courses at the community level, and work for the preventions. So that should be our major objectives. So I believe, what in the context of Nepal, what I believe, what I think is, we have a 3 tiers of health system: federal system, provincial system, and the local system. And local government these days have their own autonomy, they have own power, they have own resources. So we can collaborate with the local government, and utilize those resources for the welfare of the community, and design different interventions. For example, in the anti-tobacco campaign, I think we are going great. We have screen on we have educated till around, I think now, 6,000 school students, right? Yeah. So I think we are collecting data. So we are applied for the research as well. And then if after getting the data, we'll analyze those data and try to develop a context specific interventions in different provinces of the country. And the Nepal Health Corps team in different provinces can work on that, developing intervention strategies, and how to collaborate with the local governments, and how to influence the policy at the local levels. We such things could be done. And I think this NCD Compass course will definitely help all of the Nepal Health Corps team and the colleagues, green members colleagues, to learn about those things, and we can work together for those initiatives. Sambhavi.
Thank you, sir. Adding up to this, I would like to request Dr. Ayush Bist, Director of Nepal Health Corps, to add a few things that Nepal Health Corps can do or the green members can do after taking this course.
Thank you, Sambhavi. Thank you, Dr. Prajwal, Dr. Temo, for the wonderful presentation on this course. First of all, I would like to mention the things that has not been mentioned in this webinar that needs to be understood by all the participants. Is that the original price of the course was $299, and if you there's no possibility that you could join it on individual basis. You have to join it via Nepal Health Corps, and only you will be able to get the scholarship. And another thing is that for obtaining the scholarship, you must be Nepal Health Corps Green member. This is only valid for our valued Green members or our general members. And if you have not already joined our team, you could consider joining our Vibrant team by the link of registration is in our website. It will also be pinned in the chat box right now. So since most of the thing have already been addressed, and if there is still some confusion, you could always reach out to us, any one of us, via the email or phone call or SMS, WhatsApp group, whatever. I think Dr. Temo has already fired about the course, and it's our time that we start the registration process for the course. You will all will be in receive a mail about the detailed process of how to register the course, and let's all, including me, I will also register in this course, and together we all let's be the first batch of NCD Compass course from Nepal. Thank you.
Thank you, Dr. Ayush. I think we are at the end of the session, and to close the session, I would now like to invite our very own Dr. Pradesh Powder, founder and president of Nepal Health Corps, global health scholar at Harvard Medical School, to share his ending remarks for this webinar.
Thank you, Sambhavi. I hope all of you had enjoyed the session today. Hello, Dr. Prajwal. Hello, Ayush, and everyone presenter over here, and thank you for participating. So on the behalf of Nepal Healthcare, I would like to sincerely thank Dr. Temo for such an warm and engaging session regarding NCD Compass course. What I really admire about Dr. Temo is he is able to connect complex health challenges with live realities which resonate with all of our other experiences. He don't only teach us about the non-communicable disease, but also reminds us how this work is very important and how as a young health leaders we can deliver the change. So as at Nepal Healthcare, we are very committed on the same mission of building grassroots leadership and advancing health equity, especially on the underserved communities where the burden of NCDs are growing. So it's like in Karnali, that's so surprising, right? So people think like diabetes and hypertension are the disease of like the rich peoples, but how can we see that this the increasing burden in Karnali as well? So thank you. Dr. Timo, we are deeply grateful for your time, your wisdom, and your heart. Thank you for inspiring and walking with us on this journey. Thank you. And thank you to all the amazing participants. I hope this session has been super fruitful for all of you. Thank you so much.
Thank you, Dr. Pradesh.
Thank you.
So as we wrap up, I would like to thank each one of you joining us today. Special thanks to Dr. Temo from Organizing Committee, Dr. Prajwal, Dr. Ayush, and Dr. Pradesh for your valuable presence here and for the commitments that you have been putting to advance actions on NCDs, to prevent NCDs and control NCDs, of course. So concluding, this course is not just course only, it is a shared learning space where we can build knowledge, where we can build leadership, and we can actually make impact in the community. So we all are excited to see you enrolled in this course. I request everyone to keep eye on your email for the course details, for the application process, and for the future session reminders. On the behalf of Organizing Committee, I would like to thank you all once again. Thank you, Dr. Temo, for joining. Thank you for inspiring us. And thank you for loving Nepali food. And next time, if you are in Nepal, we will surely have a momo party. And let's stay engaged, stay inspired, and move forward and make the country and the globe NCD resilient. Thank you.
Thank you, Sambhavi. Bye bye.
Thank you very much. Challenge taken.
Thank you, Dr. Temo. Thank you very much.
Thank
Dr.
you.
Temo. Thank you,
Thank
Sambhavi.
you, everyone. Yeah, thank you.
Thank you, Pradis. Thank you.